the signal on the remdesivir trial is that it shortened hospital stays by a couple of days. So that was the endpoint they were looking at, and then they were able to achieve that. But they were still people dying. There were still people going into the ICU. So as Evan mentioned, you're going to need a cocktail of therapies like we do for hepatitis C, like we do for HIV. So there's a couple of reasons you need a cocktail. One is to increase the efficacy or the effectiveness of a drug. Second, because RNA viruses like to mutate. That's just kind of what they do. That's part of their job description. By having this ability to mutate means that you have the ability to become resistant. And so what we found with other RNA viruses like HIV or hepatitis C is that if you throw a combination of at least 3 drugs at them, that boxes the virus into a corner where it can't mutate its way out of. And so they can't achieve resistance. The other thing it allows you to do is drop the doses of each drug. So if there's any toxicity that's involved in those drugs, then you can circumvent that by giving a cocktail of 3 drugs at lower doses. And so one of the things we're testing in the lab now is are any of the things that we find have some sort of synergistic or additive effects with remdesivir. And the other point is, I again absolutely agree with Evan. We're going to need antivirals and anti-inflammatories, so things that treat the virus and things that treat our body's response to the virus. And so that's what I envision being able to help us control the virus. I think that what we want to do is have a treatment regimen that gets what's called the case fatality rate, so the number of people that actually die from the virus, down to levels we see for influenza, which is not ideal. We're seeing every year anywhere from 30 to 50,000 Americans die from influenza, but that is something that our hospital and our medical systems can handle, and it doesn't become this crisis which affects every step and every facet of our lives right now.